Okay, so we're progressing how challenging these exercises are now. So just to recap on what I said before, please make sure that you've consulted with your team before starting the exercises, depending on the type of surgery you've had. So in standing, the first one is going to be hip flexion. So you want to make sure that you're supporting yourself on a chair or something still standing. From there, you're going to lift the leg up towards your chest as far as you feel you can, and slow and controlled come back down. So I recommend holding on with 2 hands, lifting that leg up, and slow and controlled coming back down. And you may feel a little bit of discomfort here. Those muscles haven't been worked in a while and they've been tampered with during surgery. Totally normal. You're going to come up and slow and controlled lower it back down. You're going to repeat that 10 times. Once you've done that, we're going to be working into abduction, which is the one we did on the floor before, but now obviously this is a little bit more difficult because we're working against gravity. Holding onto the chair again, nice and tight, taking the weight through the good side, flex the foot, and you're going to lift the leg out to the side as far as you feel possible, and slowly back down again. Now, for some of you, you may not get very far. Absolutely fine. All I want you to do is try and get a little bit further with each movement, lifting that leg out to the side and back. And you may feel a little bit of aching in the glute muscle here. Perfectly normal. 10 repetitions of those and slowly back down again. And on to the final one, guys, is going to be a hip extension. So again, holding on with 2 hands, taking the weight through the good leg, flex the foot, and you're going to lift the leg back as far as you feel you can without the hips rotating, okay? Keeping those hips facing forward, flex the foot, lifting up, and you should feel that the bottom muscle kicks in and back down again. 10 repetitions of those and back down again. And you're going to repeat that 3 rounds, okay? So it's 10 repetitions, each exercise, 3 rounds.